Hello students, welcome to the lecture. Source data. So first of all, let's try to understand what exactly is source data. It is the first place that the trial staff records the data in. It's not the second, it's not the third, or it's not the 100th. It's the first place. So this picture really highlights what source data is. So imagine the source data is written in this book by this trial staff, and we extract the information via a USB port to a computer. So the source data is in the book and not the computer. Having said that, source can be electronic as well, such as in the case of electronic medical records. So the key message is it could be electronic as long as that is the first place that the data was recorded in. So what source data consists of? It consists of many things. Doctor's notes, ECGs, nurses' notes, lab reports, CT scan results, electronic hospital records, name it. So everything in this picture. Because the hospital is so big and so many operations are happening, right? So all of those different departments can have source data. So having established what source data is, let's look at the qualities of source data. It's highlighted by this acronym, ALCOAC, which stands for A for attributable, L for legible, C for contemporaneous, O for original, A for accurate, and C finally for complete, ALCOAC. So let's look at these qualities one by one. First is attributable. So what does this mean? This picture has a lot of doctors with masks on them. So do we know who they are? We don't know. If they were the ones who wrote the data, we don't know who it is. So it's not attributable. So what attributable means is we know who recorded that information, right? Via a signature or a name. Why is this important? That's the only way we can trust the data, right? Because if some random person from the street might walk into the hospital and write, and that's not source data. It has to be attributable to a doctor or a nurse or a hospital or a qualified and authorized staff. And second one is legible. That means it could be read. So this picture, can you actually read what it means? Vaguely, right? Having said that, I have seen doctors' handwriting which is worse than this, but somehow I could read it. So it has to be legible because we need to understand it and we need to evaluate and analyze the data. So how can we do that if it's not legible in the first place? The third one is contemporaneous. That means the source data is recorded in a timely manner. The time it was created. Let's say you do a CT scan, you get the result, and you don't record that result for 2 weeks. You record it 2 weeks later. Is that contemporaneous? No, not at all, right? Contemporaneous means it needs to happen right now, right here when it was done. So that picture really highlights what it was. The brain is like a series of clocks with time stamps, right? You do actions at a certain time point. So for it to be contemporaneous and attributable, there are certain action items or certain behaviors we need to uphold. For example, if you're correcting the data, if let's say you entered the blood pressure as 90 by 110, that's wrong. You need to correct it. Let's say you white it out and obscure it and enter the new one, 80 by 100. Is that contemporaneous or is that right? Because we don't know what happened. First of all, we can't see the first entry. And the second of all, we don't know who wrote the second entry and why it was changed. So it could be a fake data for all means, right? So how to correctly do the correction is to neatly cross out the original entry so that the original entry is still visible, and write out the new entry and you record who did that. So for this one example, blood pressure is 80 by 100, written by Dr. Magnum PI as per his exam on 23rd March 18. So we know why it was corrected, and it says the original entry was incorrect, so it was corrected. So we can trust the data. The next one is original. It has to be original. Well, that pretty girl is making a copy. I know she's pretty, we can trust her. But for data, it needs to be original, not just pretty. Next one is accurate. So accurate. Why is this important? Because we need to collect all this data and analyze it and come to a certain conclusion to test our hypothesis. So we want our hypothesis to be correct. So how can it be correct if the original data is not accurate? Original data has to be accurate. If it is 2 decimal places, it is 2 decimal places. And the next one is data has to be complete, ALCOVAC, right? C, the last one. So this jigsaw puzzle, without the missing link, it's not complete. We can't see the complete picture, right? So let's imagine blood pressure 110 slash question mark. Is that complete? Because the systolic blood pressure is there 110, but diastolic is missing. So that's not a complete data point. Complete blood pressure would be 110 slash 90, 110 systolic and 90 diastolic. So that's complete. Let's imagine you make the house, you make a good foundation, nice walls, all the furniture, beautiful painting, but there's no roof. Is that a complete house? No, right? Because if you stand in the middle of the house, it will rain and you will get wet. So the house is not complete. It needs to be a self-contained, complete piece. So having established the quality of data via this acronym ALCOVAC, attributable, legible, contemporaneous, original, accurate and complete, we have to consider how do we transfer all this source data into one single location so we can analyze it, because there are multiple hospitals, right? Multiple hospitals with different types of source data. You can't evaluate all this data or analyze all those data. You need to collect all those data into one single place. So in this case, like via all these sites, via computers and paper source, everything, you enter it into the computer electronic and it goes to a single place, and then the statisticians can analyze it. So you collect all this data using something called a case report form. We will look into case report form and queries in the next lecture, but for now appreciate the quality of source data via ALCOVAC and why it needs to be transferred to one single location. So thanks for listening to me. Look forward to seeing you in the next lecture. Ciao.